So when you have something that sweeps through the population at a very high rate of speed, you have to have many more people immune. Otherwise, the virus has no trouble finding a susceptible individual and starting a new transmission cycle. So that's, I'm afraid, what we're seeing now. Our failure to fully vaccinate our country has permitted Omicron to spread more vigorously. We now may be achieving herd immunity, but not the way that we wanted to. We wanted to achieve it through vaccination, and now we're achieving it with a terrible price of illness and even death.
One million lives lost in the U.S. during this COVID pandemic, and the real death toll could be higher. In the world's #1 economy and the so-called shining beacon of hope, why do ordinary people perish with little to no protection? Why haven't the country's safety protocols worked? Why is the healthcare industry booming while people suffer?
According to John Gaiman, a member of the Institute of Medicine, the COVID-19 pandemic has exposed long-standing system problems of U.S. healthcare. According to statistics by Open Secrets in 2021, the Pharmaceutical Research and Manufacturers of America, the American Hospital Association, and the American Medical Association rank among the top 10 agencies with the highest lobbying expenditures and spent nearly $75 million to protect their interests. The FBI recorded a 77% increase from 2019 to 2020 in hate crimes against people of Asian descent. According to Stop AAPI Hate, a California-based coalition that tracks self-reported incidents of harassment, assault, and discrimination against Asian Americans, there were over 6,000 cases in 2021.
COVID-19 cases over the past 5 weeks, and numbers are up 26% nationally from last week.
There's something else that we've talked about, and that is post-infection chronic syndrome. Many people who get the disease naturally run the risk of some later lung disease, heart disease, kidney disease, or brain disease, what's often called long hauler syndrome, and that doesn't seem to go away very well. So hopefully we've learned an awful lot about how to manage the disease, because we're not having the same death rate we had, but as you have more people getting the disease, either for the first time or over again, it will spread and some people will get sick. Vaccinations and natural immunity reduce the likelihood of severe illness and death. And until deaths begin to increase, we're not likely to see an aggressive response. And, we're not going to see an easy national response, because public health in the United States is generally not a federal issue. It is state controlled. Every state, like the Constitution, is really responsible for managing its own public health.